Welcome to the Renal Research Institute's Frontiers in Kidney Medicine and Biology, where we share knowledge and advances in kidney research with the world. In this episode, we talk with Dr. Catalina Alvarez Elias and Dr. Rasha Hussein, both research scientists at RI, about the International Society of Nephrology's Emerging Leaders program, which they are both members of the 2024 cohort. The 2-year program for early career professionals in integrated kidney care offers a collaborative platform for members to impact global kidney health initiatives and make a positive impact on the kidney health agenda worldwide. Welcome, Rasha and Catalina. It's such a pleasure having you on this episode of Frontiers in Kidney Medicine and Biology. Catalina, can you tell us a little bit about your background?
I was born and raised in Mexico City, but my family is originally from Guatemala, and I got to live in Guatemala for about 6 years. I trained medicine, pediatric nephrology, and research in medical sciences in Mexico City at the Hospital Infantil de México Federico Gómez, and later on I continued training at the Hospital for Sick Children in Toronto on transplantation and dialysis, and also at the University of Toronto for a little bit more of research.
Yeah, thank you, Catalina. This is quite a remarkable path you've taken from Guatemala to Mexico, Canada, and now to the Renal Research Institute. So, Rasha, what about you? Can you tell us a little bit about your background?
Thank you, Dr. Katanko, for this great opportunity. I'm Rasha Hussein, originally from Sudan. And after I completed the School of Medicine, I joined the Pediatric Nephrology Department at Sudan University Hospital, Khartoum, Sudan. And during this period, I completed a lot of training in pediatric and in nephrology. I received the MD of Pediatric and Child Health from Sudan Medical Specialization Board. And I did a lot of fellowship, like International Society of Peritoneal Dialysis, International Society of Nephrology Fellowship in Brazil, and now I am a PhD student at Universidade Católica do Paraná in Brazil. And I also completed the mentorship program last year in collaboration with the ISN and Renal Research Institute, and recently joined Renal Research Institute.
Thank you, Rasha. So, yeah, I should say that both Catalina and Rasha are collaborators of the Renal Research Institute for quite a number of years, Rasha, right? I think about 8 years, 9 years, Rasha,
yes.
Yeah, I think so. It's quite a...
Yes, a decade.
Yeah. So this is, and I have to say, working with you guys, I mean, this is just such a terrific experience. I'm really glad that you are now here at the Renal Research Institute in New York. Rasha, until a few weeks ago, you have lived in Sudan, a country that's really experiencing major unrest and civil war. You told me during the preparation for this conversation that you are comfortable with sharing your experience there.
The health system in Sudan, like any low-income country and low-resource setting country, is already fragile. And then the war started in my country last year, April 15 last year, and affect all the population in Sudan, especially the nephrology patient. They are lost their dialysis service. We lost a lot of patients. There is a shortage in consumable, and a lot of dialysis centers just closed because more than 40% of the dialysis services located in Khartoum, the capital of Sudan. And like any other developing country, all the services just located in big cities. And the patient and their family just moved from Khartoum because the war started initially in Khartoum. So some patients just receive dialysis in a different dialysis center. For example, they receive the dialysis in this center, and the next section maybe after a week or 10 days in another center, another city. The dialysis in Sudan is free for all the patient. It's twice per week for adult and thrice per week for pediatric. But during the war, sometimes the patient just receive one session a week or 2 weeks. It is really difficult to just speak about the situation of nephrology patient during the war, but it's really a hard time for both doctors and patient in Sudan.
Really sorry to hear through what huge problems your country goes and that you also have personally experienced. It's truly heartbreaking.
Yeah.
But and I cannot tell you how happy I am that you joined RI a few weeks ago, where you can really focus now on research, where you can focus on the Emerging Leaders Program, right? So, yeah. So, Anna Catalina, can you tell me a little bit about this ISN Emerging Leaders Program, and why did you actually apply for it?
I was not very aware of the call for applications. I got encouraged by you, by Dr. Valerie Lakes, by Dr. Maria Ferris, and on my very personal perspective, I have to confess I have never seen myself as a leader of something. It's more than I have this passion and this goal that in my vision, it moves forward by collaborations and networking. So I thought it was, by reading what was the program about, I thought it was a great opportunity to move forward this dream on improving the care of pediatric patients across the world, and that it will be very beneficial, not just for me, but for other connections that I have to learn from each other. So that was what it is. It is very good to have some mentors or an external validation that makes you feel more comfortable that you can do some things. So by getting all this encouragement from different mentors that are very remarkable and well known in nephrology, I thought, well, maybe I can do it. So I'll go ahead and just apply. So that's the true story.
Yeah. I'm so glad that you applied for this, and we are all really proud that you got accepted for this prestigious program. Rasha, what about you? Why did you apply for the program? And I guess it wasn't that simple, because you were living in Sudan with all kinds of internet problems and so on. So can you tell us a little bit about that?
Two of my mentors sent me a link to apply for this program. It was on June, I think, last year, and I already started to apply for this program. But then the war started, and there is no internet connection. I'm just focused on to saving a life of my patient, and the deadline, I guess it was on September 30. On September 29, I tried to complete my application. There is no internet. There is like a complete shutdown of internet in Sudan. So I should use to upload a video, and the video need like a very good internet. And I sent the video to my husband in another country.
Rasha, don't worry. I know this was such a difficult process for you, but I'm very glad that you were able to make it. Now we have heard how the two of you actually applied for the program and what was your motivation behind it. But I'm really curious, what do you hope to accomplish in these 2 years?
I think learning from others, the way they do things in their own countries, just with that, by knowing their experiences, like Rasha just was sharing, I think that is incredibly valuable, because sometimes we are so self-centered as humans and as countries and we think is just one way to things, or there's just one struggle that exists in our lives, and we don't see what is going on in other parts of the world. And in those parts of the world where there are challenges, people get very creative. There's smart people around the world, and they find pathways to get to a common goal that we have, which is improve our patients' healthcare. So I think that what I envision that I will accomplish is not just having this opportunity of doing the networking and connect multiple people to improve together, but to learn from the others and get this empathy on what is happening elsewhere, because that's what global health is about. Not think as countries, individuals, but think globally what can be done that can be translated in other parts. It's not that I'm thinking super big. I think it will be a specific topic, but by learning those strategies, those pathways can build up over different topics and help each other. So that's my main goal in these 2 years, to gather as much as I can and share.
I think you said it very, very well. I mean, the main topic really is and theme is for us to work together, to bring people together, to learn from each other, to be open-minded, so that we can together advance the field, right? I'm wondering, Rasha, do you have a specific vision of what you would want to accomplish in those 2 years?
As Anna Catalina said, we can just exchange our ideas, and because we are coming from different background, different culture, different facilities, and a developing country, and because from Africa and one of the sub-Saharan African country, we have like the lack of registry. So I'm focusing to just fill this gap and focus on registry and epidemiology of the kidney diseases, because you know that the dynamic of kidney diseases is extremely different between developing and developed country. And kidney diseases occur often more than we think, but also it is more treatable than we do think. So we need also to just share the experience from the developing country and how they deal with limited facilities, and with another part of the world with a developed country.
So interesting what you just said. I mean, when you said you focus on epidemiology and registries, because obviously we need the data in order to change things. Otherwise, we are just operating in a vacuum where fake news, fake truths can take over. And I think it's really important that we design actions based on real data. And you, Rasha, you have been so extremely helpful in this monitoring dialysis outcomes initiative, Mondo for short. And I'll never ever forget that you were able to contribute data from hundreds of your patients to this international global database, and that you and your colleagues would transcribe from paper records data points into Excel spreadsheets. And I think you led research into the impact of COVID-19 and the intersection with malaria, which is so prevalent in your country. And this resulted in profound insights and a wonderful publication that's frequently referenced, and that was one of the early publications on the intersection of malaria and COVID-19. So I think what you just said, really focusing on improving the data situation, is something really, really important, and that's something that can have actually a long-lasting impact. Yeah, we've learned a little bit what the two of you would want to accomplish in those 2 years. Now, let me ask you, and maybe I'll start with Anna Catalina again. What are the main roadblocks in your mind to improve kidney health globally and in your home country?
I can't be more in agreement with what Rasha just shared about the registries and characterizing the population. I think this huge lack of registries, mainly in lower middle and upper middle income countries, is a big obstacle to be able to improve the practice of the physicians. And even a bigger obstacle is the pediatric population, that since they are less numbers of patients, it's very hard to get budget or funding to create these kind of spaces, because of course we are competing with a huge epidemiology of adults having kidney disease. So I think one big obstacle and an unmet need of our field is getting this pediatric population as characterized as the adult population is being characterized, and including all these countries that are in disadvantage. Now, the technology needed, the advances in international agreements, data sharing, building local capacities, is thinking on a huge task to be done. However, there are partners that can help us, but for me, the biggest impact will be to be able to translate the technology that is available in high-income countries, to have it as well present on these countries that are in disadvantage, to be able to provide the same quality of research and opportunities to know about the population to all the world. And it sounds truly like a dream, but I think that if we never talk about it, or if we never start, then we will never move forward towards accomplish this dream. In my mind, is not just about health equity, it's about social justice. And because I've been exposed to living in Guatemala, which is a low-income country, practicing in Mexico that has also high disadvantages, and then being in Canada, a high-income country, in my mind was just unbelievable how amazing is see a patient improving with new discoveries, access to technology, access to DNA testing, etc., and just thinking on the huge population in other countries that don't even know that exist. So I think it is very important to start addressing these questions slowly. And as I said, this includes Mexico and Guatemala, as I feel part of both of Mexico and Central America. And I think that it is a conversation maybe uncomfortable sometimes because it's hard to address, that needs to be more frequent among all the experts and among us on how to achieve that and how to create local capacities to push forward inter-countries by a very strong networking.
Thank you, Anna Catalina. I certainly agree with all you said, and I feel also your passion in advancing this. I mean, Rasha, do you think there are additional roadblocks to what Anna Catalina just mentioned? So Anna Catalina did point out the lack of data, and really to help address health issues in the various countries and globally. Do you think there are other roadblocks that can hinder progress?
Yes, I echo Anna Catalina because pediatric population lags behind the adult medicine in all field of medicine. So we need to bring the pediatric on top because in Sudan, for example, more than 40% of the population is below 15 years. So we need to focus on this. Another barrier or obstacle to the health system is the access to health system itself. So as I said before, a lot of health centers just located in big city, and more than 60% of our population live in rural area, so we need to distribute the health center equally, and we are searching for equity, not equality. And so we need to just more training and more qualified trained nephrologists in low resource setting. And also we need to focus on point of care testing for prevention and early diagnosis and detection of kidney diseases.
In order really to stem this rise of kidney disease globally, I think what you just said, early detection, early diagnosis is fundamentally important. And luckily, there is also good news that more recent development of drugs that may actually slow the progression of chronic kidney disease is a sort of sliver of good news on the horizon here. So I am just wondering, someone, I believe it was Anna Catalina, you spoke about dreaming. So what would be your vision of nephrologists in the years to come?
Yeah, I'm a big dreamer. I think that dream is a way of planning. I heard that quote from, I cannot recall right now the person. But yeah, I think it is a way of planning. I think we really need to believe that networking and collaborations should be the pathway in the future. And with networking and collaborations, I'm also talking about going physically to get to know what is going on in other parts of the world. I think Dr. Sokali said in the event in the ASN that, and it's so true, by experiencing, by seeing what is happening in other parts of the world, we create that sensitivity, that empathy, and that compassion. And I think that sometimes we're so isolated in our environment, getting to know what's going on in other parts of the world, getting to know what's going on in Sudan, but we really don't see the reality. So I think this volunteering, this reach out to those colleagues working in low-resource countries or countries in disadvantage is quite important, but not just reaching out for one moment or learning for 1 month, but keeping that connection, that bilateral interaction that is dynamic and constant. Because what I can see, at least on my very short experience, is that multiple experts in the field and colleagues can go to train to a high-income country, go back home, but then the connection is lost. So those advances that are so vivid and that the knowledge is so accessible in these high-income countries is not what the other countries are living. And then that progress and that push of keeping in that loop of technology, science is lost. So I think that a way to keep those local capacities in track with the rest of the world and improve locally, we need to keep that network active, that communication dynamic and bilaterally. That is super important. I think that in multiple high-income countries, there's not awareness on the lack of access to information that there's in other countries, the lack to access to the last publications, the last guidelines. There's more and more open access publications that are very, very well accepted, but we need more communication about experience, and also the other way around. The experiences from our countries are quite valuable because, as I said, we can get very creative. We can adapt to multiple situations, and that can be also a point of learning of high-income countries, areas that there's also disadvantage, poverty. So this bilateral exchange is how I envision that nephrology should be going, that our field should be focusing. But also, as we have mentioned, and we obviously are good advocates for pediatric nephrology, including in these studies, in these huge studies, pediatric population as ethics and regulations permits, and work towards improving these ethics and regulations to be able to provide this data that we are such in a big need. And lastly, to don't monopolize with a big opinion, I think this huge issue of climate change that is affecting worldwide is something that shouldn't be abstract in our life. I think we really need to dive locally. Unfortunately, in low-resource countries or countries in disadvantage, there's no time for that. There's no money for that. They are focusing on the lack of medications. They are focusing on the lack of access to healthcare. So they could be missing that heat wave. They could be missing that carbon emissions. So that's why the other countries are there. Like, what is going on in our country? But how can we help the others? Because they are busy. They are busy attending other problems. But climate change is certainly impacting kidney disease. Climate change is certainly impacting since, very likely since conception, and that is damaging future generations, and we shouldn't miss that in our field. And I'm stopping there.
Yeah, no, Anna Catalina, all very, very valid and important points. And I'm so glad that with respect, for example, to climate change, Renal Research Institute is involved in research on the impact of extreme heat events and on climate change, of wildfires on the health of kidney patients. This is in a collaboration with Maryland University. I get the sense that there is now more and more attention paid to that, but certainly in comparison to the magnitude of the problem, still way too little. Rasha, if I may ask you, what would be your vision of nephrology in the years to come?
This is a difficult question, but I think we need to just use the impact of social media, for example, on the population to increase awareness, and even to increase awareness and training for the new doctors. And also, I expect there is like a lot of change in nephrology field, like the new modalities of therapy and treatment, like xenotransplantation. So we need also to just focus on prevention, treatment, early detection, and increase awareness, especially in developing country and low-resource setting country.
Thank you both for sharing your opinions here. Is there anything you would like to say to our visitors? We are coming slowly to the end of this really interesting conversation. Is there some final words you, Anna Catalina or Rasha, would like to say?
I would like to share a few final thoughts. I'm very proud of where I come from, and also I am as an immigrant. I always miss the land that I left, right? So I think there are many immigrants in the world, not just in this country. In many countries, populations have moved around towards the past thousands of years. That's part of human beings. What I want to share is that to those that have left their country because different reasons that are very personal, and no judgment to anyone, not to myself either, keeping connected to your country, keeping connected to the associations that work there is quite valuable. That has helped me grow, not just professionally, but personally, to still be grateful of where I am now and the privilege that I have now, but not forgetting on having a hand at least of whatever is able to be provided in knowledge connections to our community. So I just want to take this opportunity to thank, really deeply thank to Fundanier in Guatemala, Dr. Randall Lowe and all their team, because they basically had adopted me as part of their family. And it has been great collaborations and awareness of what's going on in that part of the world. And also to the ALANEPE group, like the Latin American Pediatric Nephrology Association, because they have also adopted me as I have never left Mexico. And I have been sharing and understanding better multiple countries that for me is a privilege and an honor to be able to work with them and to have the opportunity to grow. So I think that interaction is quite important, and I would encourage all of those that are working in other countries, if they have the time, if they have the opportunity to reconnect, because it's very well received and it's very rewarding. Thank you.
Thank you, and Catalina. I think this is indeed very important, not to forget where one comes from and to cultivate, to nurture these relationships. Rasha, any final words you would like to say?
I just need to ask you to pray for the people in Sudan.
Yeah. Thank you. That's we certainly will. I really want to thank both of you, Anna, Catalina, and Rasha. We really appreciate you taking the time to talk with us about your goals, about your background, about your vision, about your work with the International Society of Nephrology's Emerging Leaders Program. We really look forward to hear more about the progress your cohort makes in the field of kidney care. So really thank you again for joining Renal Research Institute's episode of Frontiers in Kidney Medicine and Biology. And we invite you all to engage with us on our social media channels and look forward to seeing you again for our next episodes of Frontiers in Kidney Medicine and Biology. Thank you and have a good remainder of your day.
Thank you.
Gracias.
Bye.
Thank you for joining the Renal Research Institute for this episode of Frontiers in Kidney Medicine and Biology. We invite you to engage with us on our social media channels and look forward to seeing you again soon for the next episode of Frontiers in Kidney Medicine and Biology.